I want to recognize Dr. Mary Bowden. Dr. Bowden is an ear, nose, and throat specialist and a respiratory specialist who previously had medical staff privileges at Houston Methodist Hospital. And I want Dr. Bowden, as an early treatment doctor, to tell us about her hospital interrelationships to her private practice and how this has influenced her life as an early treatment advocate.
And put the mic very close to your mouth, about 3 inches.
Can you hear me?
Yep.
Okay, thank you. Thank you for having me. And so I'm sort of the real world doctor. I don't have the academic credentials that the rest of these esteemed colleagues have, but I'm a solo ear, nose, and throat doctor. I'm double board certified in otolaryngology and sleep medicine in Houston, Texas. And prior to COVID, I was sort of the resource for second opinions. I was who people came to get an honest opinion before sinus surgery, because I'm known to be very conservative. I use surgery as a last approach. And since the pandemic, now I've become basically one of the few resources for patients in the 4th biggest city in the country to get early treatment for COVID. It all started because I had patients that needed testing and they couldn't get testing, and testing was being rationed, if you remember, because we didn't have test supplies. And I was the first person in Houston to advocate the saliva test, which was great because it was contact-free and we didn't run out of supplies. So my practice just became a hub for COVID because of that. And to date, I've run over 80,000 COVID tests. So in the last 6 months, I've really evolved into a early treatment advocate. I've used a combination of medications, and up until recently, I was using monoclonal antibodies, and sadly, we can't get those anymore. I just hear so many stories. At first, it was, my PCP won't see me, so they came to see me, an ENT. I became the PCP. Now it's people are terrified to go to the hospital, so I've become the emergency room. I'm giving high-dose IV steroids. I'm giving 25 grams of IV vitamin C, but I am keeping people out of the hospital, and I've kept over 2,000 people out of the hospital. And if you look at current statistics, 20 of those people should be dead, and they're not. So I see a lot of high-risk patients. I don't know if you saw my press conference, but I had a woman in her late 60s, diabetic, not taking her medications, came to me with an oxygen saturation of 82%. And she came to my clinic 3 days in a row. She got IV steroids. I gave her 80 milligrams of solumedrol based on the FLCC protocol. Thank you. I gave her 2 grams of vitamin C. I gave her a slew of medications. I threw the kitchen sink at her because she refused to go to the hospital. And in prior times, I would say, you need to go to the hospital, but she refused. But now she's alive and doing wonderfully. And it's just sickening how many patients did not receive that kind of care. And the turning point for me, when I really got angry, was a patient that his wife reached out to me. He's trapped in the ICU, a father of 6, sheriff's deputy, refused to give anything. But these hospitals give them low-dose steroids. They give them 6 milligrams of dexamethasone, 3 times a day. A lot of these hospitals won't even give breathing treatments. It's ridiculous. They won't give them the vitamins. And so basically she called me in desperation, and I testified. She sued the hospital to try to get her husband the medications he needed. I testified, we won. The hospital refused to grant me privileges, even though I have a spotless record. And I was furious. That's when it all changed for me, and I became thrust into the public because of Methodist Hospital. But it's just, I've seen a lot, and I'm angry, and I'm exhausted. I have one hospital I can send patients to that I feel safe to. I have one doctor, Dr. Joe Verone, who I trust, that I'll send my patients to, out of an enormous city, and I'm exhausted. I can't find any doctors to help me. It's a huge problem.
First of all, thank you, Dr. Bowden, for having the courage and compassion to treat patients and sharing that story. We're going to come back in greater detail in terms of how the treatment has evolved for those of you who are actually treating patients versus how it has not evolved for over 2 years throughout the rest of the medical establishment.